Hi, I'm Dr. John Parker, and I want to welcome you to our video today where we're going to go over how we treat irritable bowel syndrome, ulcerative colitis, and Crohn's disease from a functional metabolic and a functional neurologic approach. So we use functional medicine in our office, and what we do is we run labs to figure out your nutritional needs. We run labs to look for things like leaky gut, food sensitivities, genetic food sensitivities, barrier system problems, inflammation patterns, and we turn around and we use nutritional approach to deal with the metabolic problems. And we also look at you from a neurologic perspective, looking for neurodegenerative pathways related to having metabolic breakdown. So my name is Dr. John Parker, and I've been a chiropractor for 12 years. I spent extensive postgraduate time studying neurology through the Carrick Institute of Graduate Studies, and I have over 350 hours in functional neurology at this point. I also have extensive background studying under Dr. Karazian in Apex Energetics, studying functional and metabolic nutrition. I have a background in functional endocrinology, functional neurotransmitters, and functional blood chemistry. I've studied under Dr. Michael Johnson, and he's the author of the book, What Do You Do When the Medications Don't Work? So my goal today when I go over some things is have you to have a better understanding of how can I help you with your chronic health condition. And one of the things I want you to realize in our society is we have a really phenomenal system for dealing with acute health crisis. But we're absolutely horrific when it comes to taking care of people that have chronic health conditions. And the reason is they're trying to use a model that's designed for acute health crisis to manage that problem. When we look at people that have things like Crohn's disease, irritable bowel syndrome, ulcerative colitis, along with other chronic health conditions such as type 2 diabetes, celiac disease, insulin resistance, thyroid conditions, chronic fatigue syndrome, fibromyalgia, all the way down into insomnia, sleep problems, and depression, they have common threads of what's wrong with them from a whole body approach. But they don't get looked at that. They get looked at in our system from a very linear, I take care of one type of problem, and I treat that problem or symptom with a certain type of drug, and I only run a certain lab for that one marker that I'm looking for. So people tend to have chronic health conditions typically get underserved, in my opinion. Okay. So when they come to me with those different labels, the things that they have wrong that I look for are metabolic imbalances in their body systems. First thing, they have metabolic things like anemias, meaning they're not having a good fuel delivery problem. They're having a poor fuel delivery problem with oxygen. Thyroid dysfunction, their base metabolic rate they're having problems with, whether it's hyper or hypo, and most of the time they have those problems because they have an autoimmunity. They definitely have unstable blood sugars. That's probably the number one problem we have in the United States is sugar regulation problems. When you look at our food chain, the simple sugars, the processed foods, your brain needs regulated fuel to run. And not just for you to cognitively think and perform your daily activities, but for your brain and autonomic nervous system to control how your body works. Adrenal gland dysfunction is related to high levels of stress, whether it's emotional stresses, financial stresses, physical stresses, and chemical stresses from the exposures that we have. And on top of that, that tends to lead into hormonal imbalances. Probably the number one connection that I look for when people that have gut issues is autoimmunities. Autoimmunities means your immune system is having problems differentiating self tissue from non-self tissues, which are the foreign invaders that it's supposed to typically be looking for. People with gut problems tend to have a lot of immune system imbalances. because you have barrier systems that keep things out. You have skin barrier systems, you have your lung barrier system, and you have your brain barrier system. They keep pathogens out and they keep things in. So in your gut, you have a barrier system, and that barrier system keeps things out. And when you have problems with that barrier system, pathogens, proteins tend to get into your bloodstream, and they fire up your immune system. So your immune system goes through a reactive phase, and it can go through this phase for years and years, where you're being exposed to a pathogen continually, and it's always on the hunt for that pathogen, and it tends to become dysregulated, and then all of a sudden it starts just attacking your own tissues. Self-tissue attack, autoimmunities, like your thyroid, your pancreas, your gut, your myelin sheath. There's a host of things that can be autoimmunity-wise that we need to look at, especially if you're having problems like this current topic. Hidden gut infections will also cause your immune system to drive low oxygen, and the ultimate beast that all the people tend to have with these chronic conditions is really high inflammatory markers. So we do things to pull down inflammation, we do things to balance out your immune system and kind of calm down those fires while you go through the healing process. The other thing we look at people from is a metabolic standpoint. People start having, besides a metabolic problem, we start looking at them from a neurological standpoint. When you have metabolic issues, that we just talked about, that leads to the pathways of your brain, the different neurons, to start to fatigue. And different areas will start to cause different symptoms to show up. Over time, it ends up with neurodegenerative processes that we tend to associate with problems. So I'm not looking for a huge hard lesion in your brain. What I'm looking at when I do a neural exam on you is to see if there's weak pathways. We're going to go through some of the reasons those pathways fail, but also how do we stimulate doing brain-based therapies to increase the function of your brain. I want to start by talking about metabolism. Metabolism, in a nutshell, means we take in the food we eat, we properly digest it so that we have things bioavailable, and we turn those into energy. My big question for you is, what do you think is our highest energy need of all of our systems for when we metabolize things? Do you think it's our endocrine system, our digestive system, our nervous system, our immune system, or our cardiovascular system? Most people think it's our digestive system. 30% of your energy is the energy to run your fuel for the brain. Okay? Your brain, spinal cord, and nerves use up 30% of that energy. And of that 30%, the majority, the highest consumer of oxygen is your cerebellum. And we're going to go through what the cerebellum does. But we need properly functioning gut health for good metabolism to create the energy to have a well-functioning brain. And we call that the gut-brain connection. The gut-brain connection I want to talk about is related to who the father of modern medicine, Hippocrates, said, look to the gut. There you will find the origin of almost all human illnesses. They say death begins in the colon. Gut inflammation leads to an immune reaction to a food sensitivity or an infection, leads to production of inflammation in the gut called cytokines. Cytokines do two things. They create a cascade of leaky gut, which causes more food sensitivity. They also cause inflammation to cross into your bloodstream, which gets carried in, and that inflammation, those cytokines react with brain cells. Those are called microglial cells. Those microglial cells get activated and cause inflammation of the brain. Therefore, they say fire in the gut, fire in the brain. 70-80% of your immune system resides in your gut. Anything that causes an immune battle in your gut will cause and trigger inflammation. Things like food sensitivities, chronic infection, bacterial infection, parasites. I screen people with a really high quality DNA stool profile test, and we find usually 2 to 3 hidden parasites. If you have parasites, you'll have chronic inflammation. The people I treat tend to have had parasites for years. Mold, fungus, yeast, viruses, and the undergrowth of good bacteria are the things we look for. So when people have immune challenges in the gut, they fire up cytokines, which fire up inflammation in the brain. And 90% of the brain cells are microglial cells. You activate the microglial cells, that causes brain inflammation. So in the big picture, IBS versus Crohn's. Both cause similar gut symptoms. Now, when I say Crohn's, I'm going to group also ulcerative colitis in that, so I don't have to break it down further. Both can cause symptoms throughout the body, and the causes of each are very different. IBS common symptoms: abdominal pain, fullness, gas, bloating, acid reflux. There's different categories: IBS constipation, which is IBS-C, IBS-D, which is diarrhea, or you can have IBS-A, which is alternating. The symptoms can come and go. People tend to have relief after bowel movements. 1 out of 6 people have that, and this is the most common visit to a gastroenterologist. When you go to the gastroenterologist, they diagnose IBS by exclusion, meaning they're looking for different things wrong, ulcerations, Crohn's disease, and they can't find anything wrong, so they just say you have IBS or an overactive system. The other thing is 60% of IBS sufferers have psychosocial disorders like depression and anxiety, and it's no wonder, right? Not only is it a socially impactful problem, but they have inflammation in the brain. They have high incidence of things like headaches, fibromyalgia, and chronic fatigue. Why? Because we talked about the gut-brain inflammatory connection. Causes of leaky gut linked to IBS are linked to gut infections, abnormalities in the gut flora, and overactive sympathetic nervous system, where you have a brain imbalance. Disorder the interaction between the brainstem and gut. Your brain is overfiring. You have 2 parts of your autonomic nervous system. You have your sympathetic and your parasympathetic. Your sympathetic is your stress-related responses, and your parasympathetic is the relaxation type. And we call that side the feed and breed, and we call the other side the fight or flight. Everybody's heard of this. But your sympathetic nervous system is dampened down by good brain function. So when we look at everything, your brain drives the control of your sympathetic nervous system. So information comes from your cerebellum. Both sides, you have one on each side. They drive your opposite frontal lobes and cerebrum, and it sends signals to dampen down your brainstem, your midbrain, the area that controls your autonomics for sympathetic and nervous system and parasympathetic. So when you start having problems or weaknesses in the drive from the cerebellum to the frontal lobes to dampening down that midbrain, you start to tend to have sympathetic escape, because it's a survival-based mode, and it's predominantly does want to escape, but your midbrain dampens it down from control input, inhibitory processes from your upper brain. When you have overload and failure to dampen down that midbrain, you get a lot of escape, and one of the things you have is symptoms like IBS. Other things you have chronic pain and chronic fatigue when you have overfiring sympathetic nervous system. Irritable bowel syndrome, urinary tract infections we see a lot, fibromyalgia, migraine, tension headaches, postural adaptations. You start losing extensor tone and you start to have poor posture. Those are signs of overfiring sympathetic nervous system and poor drive from the upper brain. You have adrenal gland stimulation, a lot of stress release, high cortisol. High cortisol levels thin your barrier systems in your gut. Blurred vision, increased sweating, insomnia and sleep problems, heart palpitations, higher blood pressure, cold hands and feet, sensitivity to light and sound are all signs of a high firing sympathetic nervous system. And when we do things in our office from a neurological standpoint, we have you do brain-based activities from an exercise point where it's designed to drive the brain to dampen down these areas. Upper brain fatigue can also cause depression and anxiety, difficulty with verbal expression, fatigue when you're driving where you used to not, decreased memory, lack of focus, lack of motivation, altered sensations, numbness, tingling, failure to dampen down sounds, things like that. And this all happens from the chemical stresses we have, physical stresses, emotional stresses, and we call that brain fatigue, meaning you have fewer nerve impulses. We do a lot of testing to find out the areas you're having your problems. Okay. We do an extensive CBC, complete blood chemistry panel. We do lipids. We do A1Cs. We look at CBC with auto differential. We look at total iron binding capacity. We look at thyroid markers. We look at homocysteine levels, C-reactive protein, fibrinogen. We look at a lot of inflammatory markers to see if you're having problems with this. We look at liver clearance. We do a salivary hormone test. This test tells us your level of cortisol, the time of day, do you have the normal rhythm? Are your adrenals affected? Are they depleted? So that we can support you properly. When we do a stool test looking for parasites and hidden infections, we use a very advanced lab where it's a DNA stool profile, meaning I'm not looking at your DNA, I'm looking at the DNA of all the critters that you have hidden in your gut so that we can eliminate them and heal your gut properly. Cyrex Lab is recently opened. It's been open about a year now, and it's a phenomenal lab. It's a very cutting edge way to look at leaky gut, food sensitivities, cross-reactivities, food sensitivity causing cross-reactivity and autoimmunities. And we can look to see where are you at in that process. Because if you're in the reactive stage for an autoimmunity, we can dampen it down before it becomes full-blown with tissue damage. And it also helps us to tailor specific dietary response needs to dampen down your immune system and heal your gut. And there may be some things we need to eliminate from your diet. But when I do functional medicine with people, they're metabolic treatments based on our nutritional products being dispensed in accordance with lab findings. And that's probably the biggest difference from what people are used to when they get nutritional products dispensed to you. What we do is we run labs and we dispense nutritional products based on your specific needs versus just getting you some generalized supplement. When we do, we look at the gut, we look at thyroid and adrenals, we look at liver clearance, biliary clearance, anemias, sugar regulation, autoimmune regulation. If there's an imbalance in your brain, we look for those imbalances so that we can treat it from a functional approach using brain-based therapies. The thing about the cerebellum and the brain, your brain requires two things to function properly. It needs fuel in the form of good glucose, and it needs proper oxygenation. It also needs good activation. So when we do exercises with people to drive specific weak pathways in their brain, we do those pathways, we exercise them to get better drive, better endurance, less fatigue, and better function. We also look at people from a neurotransmitter perspective when we deal with brain issues so that we can support your specific neurotransmitter needs. Crohn's disease. we want to talk a little bit more about Crohn's disease. It's an inflammatory bowel disease along with ulcerative colitis, and both are autoimmune based. So everything I've talked to at this point, we use also for people who have Crohn's disease and ulcerative colitis. They take a real good detective to figure out where are you having the autoimmune response that's driving this problem. Okay, it can cause ulcers, scar tissue, fistulas. It's an autoimmune disease, and typically the diagnosis is from a colonoscopy or biopsy, and they have symptoms of waxing and waning, which is really common in autoimmune. You'll have periods where it gets better, and then you have long periods where it's really bad. It's similar to IBS, except it has a really heavy autoimmune side to it. They have a lot of anemias associated because they have bleeding, things like that. They also tend to have things like peripheral neuropathy. It can lead to stroke, headaches, and definitely depression, like we talked about with the gut-brain connection. So the thing about Crohn's is your immune system is mistakenly attacking your body. Other common autoimmune conditions people tend to have when they have Crohn's or ulcerative colitis or even IBS is Hashimoto's thyroiditis. They can have lupus, rheumatoid arthritis, type 1 diabetes, pernicious anemia. 1 out of 5 people are actively diagnosed as autoimmune in our country. Most people don't even know they're autoimmune. They just know they have these problems. And my question is, do you have this problem? You need to be accurately diagnosed and properly treated from a functional health model. Because all they're doing in the medical model is slamming you with corticosteroids. So when your problem gets big enough, they squash your immune system to calm down the reaction. And even your medical doctor knows they're not going to leave you on steroids for a long period of time if they can help it, because they know how devastating the cascade of health events from there. Or the other thing is they may remove part of the bowel. Our natural approach to metabolic problems with Crohn's disease and ulcerative colitis is to remove the triggers to your immune system, the things that are driving it, modulate and balance the immune system, correct the damaging effects of the brain and gut, heal the gut, look for food intolerances. Common ones are gluten, casein, soy, eggs. We look for those things. Hidden infection, that's a huge one. Unstable blood sugars, problems with essential fatty acids, stress of adrenal glands, and hormonal imbalances. So how do you know if you have all these problems? We test to see, okay? We do complete blood work using functional ranges, meaning we look at your blood work from a physiological function, not just a standard bell curve. So we don't want to just compare you to the sick of the sickest. We do adrenal stress index, hormonal testing from a lab called Diagnostics in Kent, Washington, 2105 DNA stool profile from Metametrics out of Atlanta, Georgia, and Cyrex labs we use for leaky gut, food antibodies, and autoimmunities. My big question is, have you had these tests done? And I guarantee you haven't. I very rarely have people have a lot of good quality tests. And the biggest reason is your doctor's working in an insurance model where he's only running tests based on what the insurance pays for, because he doesn't want to step out of that zone, and they're not going to do anything different but give you the drugs they're giving you anyhow. So my point right now is, and most people know this, if you want good quality, individualized health care, you're going to have to reach into your pocket and you're going to have to pay for it. And why shouldn't you? Because does insurance pay for your car payment, your house payment, your food, better nutrition? Of course not. And we all know these things. So when we work with people, they have an out-of-pocket investment in their health. And we set it up so that they can get quality care, individualized treatment like that, for an affordable out-of-pocket expense. It all depends on what people have wrong. Your insurance may contribute partly, but people do have an out-of-pocket expense. What makes our office different from every other doctor that you've seen? We treat people neurologically and metabolically. I'm here to tell you tonight, I leave no stone unturned to determine the exact cause of your condition. Okay, so what's next? I offer people where they can come in for 2 visits at a discounted rate, and I'll have that on here in a minute. Okay. I want to do a complete neurological exam on you. I want to review your existing labs. I want you to fill out our metabolic assessment forms and neurologic assessment forms that are broken down into body systems so we can get a really good look at your health status. Your significant other or spouse has to come to both our first 2 visits. After that, they don't have to come at all. But I've found that if people have good support, we have great outcomes. On our second visit, I do a complete case review. I review our testing recommendations. I review our neurologic findings. I overview a treatment plan with options. Review of your financial responsibility so that you know and your spouse knows before you begin, down to the penny, what it would cost in our program to regain your health. Normally, I only accept 5 IBS Crohn type patients a month. I work with different conditions. The cost for these first 2 tests is normally $450. If you call in and get our paperwork, I'm offering you these first 2 visits for $79. I do that so I can see if I can help you without you having a big expense. I don't like to just charge people money if I can't help them. I like to go through things. I have 3 rules for acceptance in my office, though, that you need to be aware of. I take people that are dedicated to changing their health. So you have to be willing to make serious life changes. You have to take accountability for your health. And I want to review again, insurance and Medicare only pay a small portion of this care. Most people have an out-of-pocket expense that runs in the range of between $100 and $300 a month for 12 to 18 months to get the care that they need and regain their health. So on a scale of 1 out of 10, you have to ask yourself, how serious is your illness? How has it affected your relationships? How has it affected your work, your ability to enjoy life? On a scale of 1 out of 10, how serious are you about eliminating your illnesses? And I want you to know, due to time constraint and the level of clinic that I've developed, I only accept people that are truly committed to changing their life. So I know I went through a lot of things. I hope you have an interest to see if I could help you. Feel free to call our office or download the paperwork, and we'll get you in, and we'll see what we can do to help you. Thank you very much.